back to Grad Girl Rambles. It's Brianna here to talk about school psychology in a clinical world. So I think it is continuing to grow, this idea that people trained in school psychology can work in clinical pediatric settings. So I'll mostly be talking about like from the child side, the pediatric side, but I kind of want to talk about like the challenges that I had and kind of like how I'm making it work for me. So I don't regret my getting my degree in school psychology, and I think it's actually really been an asset in like getting an internship, getting a postdoc, and just like in the work that in our training, it really, especially working with children, it really transfers well into a clinical setting. Now, the reason why I see myself going into a more clinical setting post-doctorate is a different video, but I want to talk about like why it works. So in school psychology, my program at least is both APA accredited, NASP approved. So we've got training in both that will really set us up to thrive in any kind of setting. The issue is that a lot of clinical settings still do not, I'll just say, value school psychologists in their training and what we bring to the table. And so I experienced it in when I was applying for internship. There were a lot of places I literally could not apply to because they specifically say they only take applicants from clinical and counseling programs. And then you have some places that say they accept students from school psychology programs, but in the APIC directory, when you look at the history of who they've had in their programs, there are no school psychology interns. And so I think about that when I was applying. And so as I kind of applied to internship, in the first phase, I applied to mostly integrated behavioral health because I felt like that was like a cleaner shift. And I still think it is, but in pediatric psychology, I'm finding that my school psychology background is not an issue at all. One of my supervisors is actually a licensed psychologist who graduated from a school psychology program, and so it's also been really nice having a main supervisor who kind of knows that bias that a lot of people have, and because he went through it himself, he's been very helpful in being able to kind of navigate this process, like as postdoc and all that other stuff. But what I've seen in specifically a pediatric psychology internship is that really the biggest learning curve for me is just understanding like the medical complexities of the kids that I work with. The strength coming from a school psychology program is that I am highly trained in assessment. So obviously in schools, there are only so many assessment tools that we use to do evaluations with students. But we're so trained in assessment that at least in my experience, being able to pick up other assessments, do it, briefly with someone, read the manual, it is not difficult for me to learn a new assessment and give it to someone standardized. Like that is not something that I had an issue with. And for other clinical or counseling programs that don't have as much of a focus on assessment, I could see like why school psychology is such a great fit in the clinical world. For me in pediatric psychology, I think it's really important too, because a lot of the kids all of the kids I was assessing have some kind of medical complexity. And so writing up the report is a little bit different, but being able to use those observations during the testing sessions to conceptualize like why these children are having some of these difficulties, because for them it's not just they're having issues with executive functioning, or this child has a lot of anxiety, a lot of depression. It's like this child also has insert medical condition here, and these problems didn't start until after they were diagnosed or after they started having these medical symptoms. And so being able to write that in a way that makes sense for families has been, I think, like really important to kind of bring in my school psychology knowledge. The other part is that I know how schools operate. I have seen the reports that come in from private practices, hospitals, where the recommendations for the schools just like don't make a lot of sense. There are a lot of things that are recommended by psychologists outside of schools that just are not feasible and also don't make sense for schools. And they're always like, there's always this like prescribed IEP, which sometimes you do an assessment for a child and they don't need an IEP. I think it's interesting that sometimes the recommendations just include it. Like if a kid is diagnosed with ADHD, you don't necessarily need an IEP just because you have ADHD. Not all ADHD is so impacting that an IEP is required. So when I was doing my reports, I would kind of use the template that was provided, but I was like really cutting stuff to make sense for the schools. And I'm hoping that whenever the schools receive those reports, the recommendations I put in there were actually helpful because I know what schools have the capacity to do and what they're actually legally required to do. And that's just kind of like my own little thing that I did. And I think my supervisor appreciated that. I had a different supervisor who was not trained in school psychology, and I think she appreciated that I paid really close attention to some of those recommendations I was writing for those kids. The other thing is that in schools, we're always working on a team, multidisciplinary teams with speech, OT, PT, reading specialists, social workers, like all of these people, we work with them constantly all the time. In pediatric psychology, because you are working with kids who have these medical complexities, we are always working on teams, and it's always different teams of people. So on my primary track, I do the consultation liaison service the full time that I'm on internship. That is one of the things that does not change across the different trimesters. And for each patient that I go see inpatient, there is a huge group of people that I can consult with to understand like what's going on with them. So there's the person who put in the consult for psychology, you know, checking in with them, like what was the consult for, what were you seeing, how's that impacting what you're able to do while they're here in the hospital. There's also Child Life, who I love working with. They're so great, and I think in my experience so far, they're the ones that I feel like are like on the same page as me. And so there's like one Child Life specialist specifically who's usually working with the kids that I'm seeing in the hospital. And so whenever I see her on there, I'm like, hey, checking on our friend, like what's going on? And they're like, oh my gosh, like I went already, it was so great. And so being able to have that multidisciplinary experience in the schools, I think makes me such a great asset to these different teams working with different providers in different specialties to support the children that I'm working with in the hospital. The other thing that I think is part of school psychology training that people don't always recognize is our training in systems. So schools are systems, hospitals are systems, like everything is a system. And the unfortunate part about school psychologists is that we're really trained well to work within systems and do systems level work. In schools, you don't always get to do that as much because depending on where you are working, you're doing a lot of assessment, you're doing a lot of like ground level consultation, which is like a small system, but we don't really get to work kind of like system wide. For internship, I'm not doing a lot of that just because I'm like trying to get in my clinical hours and that's just what we're doing. But in the clinical world, like being able to work within a system is really important, especially for me where I'm interested in early childhood work. Like being able to work within a system within like a child development center or, you know, Head Start, like kind of like what I'm going to be doing for postdoc, is a great asset, and it's really tying in my school psychology training with this like clinical pediatric world. And so I think that there's a little bit of a shift. Even some of the faculty from my program have, you know, said, you know, when I graduated 10 years ago, we didn't have these many options for internship because no one would accept us. And so the fact that there's been such a change in like 10 years, and then I'm sure there will be a a greater change in the future is that school psychologists have so much training that is kind of just like dismissed, and more people are recognizing it. So I will say the interesting thing about my postdoc at Brown is that when I was looking at postdocs, at first I started looking at places I really appreciated their internships and would have been very happy there for internship. I looked to see if they had postdocs. And a lot of them did, so I applied to them. And then I was also just looking specifically for early childhood. And when Brown popped up, I was like, oh, did Brown not have an internship? I didn't realize that. And when I looked it up, they only accept clinical and counseling for internship. But they broaden that for postdoc. And I think it's really interesting because maybe the assumption is if you did your internship year in a clinical setting, like, okay, we'll look at you for postdoc. But there's some places that are still like, no school psychology. And that is interesting to me because there's this idea that like we see the value after you've had a little bit of clinical training, which I can understand, but they also aren't open to being the one to give you the training, if that makes sense. Like you see the benefit, but you're like, we'll let somebody else kind of like test the waters before we let you in. It's a little gatekeepy. Boop, boop, boop. But it's fine. It's fine. So my hope and what I've recognized is that some places that don't accept school psychology students for internship, but do for like postdoc, they sometimes have school psychologists on staff and faculty. And it's almost like once you've done all your training and you are like settled into your career and you're licensed and you've like met all these milestones and proven yourself, it's almost like then you get into these places and then you start opening the doors for people who are behind you in their training. I'm not trying to shake anything up, but I do think that there is a world where school psychology trained doctoral level psychologists don't have to fight so hard just to work in some of these spaces. And I know there's a shortage of school psychologists in schools, and I know that. But I also think that it's a disservice to keep certain doors closed for school psychologists who aren't necessarily staying in the schools. And that's all I'm going to say on that. I kind of went off a little bit, but the point is school psychologists, we can be in these other spaces and it doesn't have to be a fight. It doesn't have to be a fight. And I'm just glad that I have not had to fight as hard as the people before me. And I just hope that it kind of, gets a little more equitable, a little easier for the people behind me. Anyway, that's all. That video was longer than I thought it would be, and it's fine. But I will catch y'all later and see you. Bye.